If you are a foreign-trained pharmacist looking to continue your pharmacy career in Canada, becoming a licensed pharmacist is just one option. Another increasingly popular pathway is becoming a pharmacy technician, a rewarding and regulated role with a shorter licensing process and strong demand across the country. But I'm guessing you already know that, and
that's why you're here.
In this video, we'll walk you through every step you need to take to become a licensed pharmacy technician in Canada, from credential evaluation to provincial registration and immigration requirements.
Let's get started.
Before we begin, make sure to download our free step-by-step guide on how to become a licensed pharmacy technician in Canada. It's linked in the description and will help you follow along with this video. Let's start with the big picture, the general pathway. While there are provincial variations, most foreign-trained pharmacists aiming for a pharmacy technician license in Canada will go through these core steps. Think of this as your foundational checklist, a series of milestones you need to achieve. So
let's go over the normal checklist stuff.
First up, you'll need to get your foreign pharmacy education assessed for equivalency to Canadian standards. This crucial step is handled by the Pharmacy Examining Board of Canada. As the national certification body, PEBC evaluates your foreign pharmacy education to determine its equivalency specifically for the Canadian pharmacy technician pathway, ensuring your credentials align with Canadian standards. To initiate this process, you'll need to submit detailed academic transcripts, your degree or diploma, proof of internship or practical experience, and often a letter of good standing from your original licensing body. All documents must be certified copies and officially translated into English or French if they aren't already. This step can often be initiated outside Canada, allowing you to get a head start on the process before even arriving. Demonstrating strong English or French language skills is also non-negotiable for patient safety and effective communication in a healthcare setting. Common tests include IELTS, CELPIP, or for French it's TEF or TCF. These tests can be taken anywhere in the world, and results usually have a validity period of 2 years. Another
important step
for most internationally educated professionals is that they usually need to complete a recognized pharmacy technician bridging program or an accredited pharmacy training program in Canada. These programs help you adapt to the technician's role, focusing on Canadian protocols, legal frameworks, and specific responsibilities. These programs typically range from 6 months to 2 years, depending on whether it's a bridging program or a full diploma. They generally require you to be in Canada, as they include significant in-person practical and lab components. And while some programs may offer online theoretical components, practical labs and clinical placements will require physical presence. After successfully completing your bridging program, you'll likely face 2 main exams administered by PEBC. These exams are designed to ensure you possess the necessary knowledge and skills to practice safely in Canada.
Exam! Oh!
First, the qualifying exam part 1, which is a multiple choice exam that tests your theoretical knowledge. Second, the qualifying exam part 2, the objective structured clinical examination. It's a practical hands-on assessment of your skills. While the MCQ might sometimes offer remote options, the OSCE almost always requires you to be physically present in Canada due to its practical nature, and passing both parts is essential for PEBC certification. For such licenses, hands-on experience in a Canadian setting is mandatory. You'll complete a supervised practical training period, often called an internship, practical, or SPT, in a licensed Canadian pharmacy. This allows you to apply your knowledge and skills under the guidance of a licensed preceptor who is either a practicing pharmacist or a pharmacy technician. The duration can vary by province, but it typically ranges from 240 to 480 hours, usually completed over several weeks or months. It's a prerequisite for provincial registration, and it definitely needs to be done inside Canada, as it requires direct supervision in a Canadian pharmacy. Finally, you'll take a provincial jurisprudence exam that will test your knowledge of laws, regulations, and ethical guidelines governing pharmacy practice in the particular province where you intend to get licensed. This is also taken inside Canada and is administered by the respective provincial regulatory body. And
here's where things get a little bit tricky.
Because while PEBC sets national standards for qualifying exams, the registration and licensing are ultimately handled by the provincial regulatory bodies. Before I continue, I want to share something very strange that I recently found out. I was looking at this channel's statistics, and 90% of you who watch my videos are not subscribed to the channel. So please consider subscribing. That gives me a signal that you are finding my videos helpful, and that encourages me and my team to continue to do our research for you and make videos. So tap that subscribe button. Let's look at the provinces, their regulatory bodies, and their specific considerations for foreign trained applicants. The Ontario College of Pharmacists typically directs individuals to complete a pharmacy technician program in Ontario, followed by the PEBC exams and a structured practical training program. They often require specific bridging education, like the courses approved by the CTS, Canadian Career College, or University of Toronto's continuous professional development programs for internationally educated healthcare professionals. The College of Pharmacists of British Columbia has a detailed pathway for international applicants, often requiring completion of a recognized bridging program like the Canadian Pharmacy Practice Program at UBC, along with specified practical training hours and successful PEBC certification. They emphasize competency in BC's unique regulatory environment and patient-centered care models. The Alberta College of Pharmacy outlines steps for internationally educated pharmacy technicians, strongly emphasizing PBC certification and a period of practical training, which must be completed under an ACP-approved preceptor. They focus on the practical application of skills to Alberta's specific pharmacy practice standards. The College of Pharmacists of Manitoba also requires PEBC certification and a period of practical training, often with specific requirements for the type and duration of practicum. They ensure applicants are familiar with Manitoba's specific pharmacy practice standards and ethical guidelines. The Nova Scotia College of Pharmacists follows a similar process involving PEBC certification and practical experience, often with a focus on community and hospital pharmacy settings within the province. Their requirements ensure that technicians are prepared for the diverse practice environments found across Nova Scotia. Provinces like Saskatchewan, New Brunswick, Prince Edward Island, Newfoundland, and Labrador also have their own regulatory bodies and specific registration processes that follow the general PEBC certification pathway. One important thing to note here is that there are certain healthcare professions where professionals get exemptions based on their country of education, but not in this case. The PEBC exams are mandatory regardless of where you were trained. There are rare cases where licensed pharmacy technicians from jurisdictions like the UK or USA may receive partial credit. In such instances, PEBC or the provincial body
can weigh them individually and make decisions on a case-by-case basis.
Which must be confirmed directly with them. It is always better not to rely on assumptions and to check official sources. Another critical point for foreign applicants, which directly impacts your ability to complete the licensing process, is whether you need a work permit or PR to get your license. The short answer is yes, you will need a valid legal status to study, work, or complete the various stages of licensing requirements in Canada. You cannot complete most of the in-Canada requirements without it. If you're enrolling in a bridging or diploma program at a DLI, a study permit is required. Once you complete your studies at a DLI, you might be eligible for a postgraduate work permit. The PGWP would be one pathway to complete your supervised practical training, as it doesn't require a specific employer. Some applicants might even secure a job offer from a Canadian pharmacy that is willing to support an employer-specific work permit for their internship period. This would require an LMIA in most cases, which can be more complex to obtain. But if we talk about taking the exams, while you might theoretically be able to enter Canada on a visitor visa to take a specific exam like the OSCE, it is generally far more practical and less stressful to have a study permit or a work permit if you're going through the full licensing process. To actually work as a licensed pharmacy technician in Canada, you will definitely need a valid work permit or a PR. Provincial regulatory bodies will require proof of your legal ability to work in Canada before they issue your full license and allow you to practice. This is a non-negotiable requirement for provincial registration. In the past, I have helped pharmacists obtain Canadian PR, so if you want to discuss your options, feel free to schedule a So if you want to discuss your options, feel free to schedule a strategy call with me. The link is in the description. While you can initiate the credential evaluation and language testing from outside of Canada, the bulk of the licensing process will require you to be physically present in Canada with an appropriate status. There are several pathways to obtaining a work permit or PR. Express entry is one option. NOC 32124 is eligible under the federal skilled worker category. Many provinces also offer healthcare focused provincial nominee programs which can fast track your PR. I'll talk about it in detail in our next video, so keep an eye out for it and turn on the notifications so you don't miss it. All in all, becoming a licensed pharmacy technician in Canada is absolutely achievable, and becoming a licensed pharmacy technician in Canada is absolutely achievable with the right steps and a clear mindset. To begin your journey, visit the PEBC website to start the credential evaluation process. Next, research the specific licensing requirements for the provincial college where you plan to live and work. Each province may have slightly different expectations. Then explore DLI, accredited, bridging or diploma programs that align with your educational background and career goals. Finally, plan your immigration pathway by reviewing options on IRCC's website. And if you'd like my support in choosing the right bridging or pharmacy tech program or applying for a study or work permit, I'd be happy to help. Just reach out using the links in the description. I hope this video helped you understand the step-by-step process to become a licensed pharmacy technician in Canada. If you're still exploring your options, don't worry, I've linked a free guide in the description to help you make an informed decision about your education and licensing path. Take care and good luck on your Canadian journey.